talk. This is how my husband found out that a company he worked for 40 years now was going to mandate this vaccine. On the letter, it demands by October 15th, all employees are required to complete the vaccination status form, and by January 1st, all employees must be vaccinated. Followed by a statement saying, COVID-19 vaccines have proved to be safe and very effective at protecting individuals against serious illness and health. Did I mention I'm a nurse? I probably didn't mention that. We all know that that's not true. Almost 15,000 vaccine-related deaths, severes, with hundreds of thousands of adverse effects so far. By admission from the governor himself, there were 25% people in our hospitals right now suffering from COVID who have been vaccinated, and updated this morning by the VPH, 30%. Those people have been vaccinated. I work in this field, and the nurses I talk to, they tell me that every COVID patient they have has been vaccinated. I heard very few weren't. They are lying to you. We are no longer in a state of emergency. The daily cases along with the hospital bed data show that alone. We have a flat curve on the graph for 0 to 19-year-olds, but still our children are wearing masks and now being coerced into vaccines at 12 years old. What will the government do when there's no bus drivers to bring our children to school? What will they do when there's no teachers to teach our children when they arrive at the school? What are they going to do when the nurses who care for you, when there's not one in a hospital to take care of you or your mom or dad or loved one when you show up ill? Because they've all been mandated to get the shot. And they've decided against it, and it's their right. What are they going to do when the biggest aerospace company in Connecticut has half of its employees let go and aerospace manufacturing stands still? Because the union allowed this. That will not they will not stand with the workers, and why should they? They're bankrolled by the government. My husband spent 22 years proudly serving his country and the state of Connecticut as a guardman. He's sent overseas on missions, 911, where I've raised 5 boys by myself multiple times. He is 61 years old, retired from the military. He has to continue to work because he's not old enough to gain full Social Security benefits. If the governor's allowed to continue this, and Pratt Whitney is allowed to do this, my husband will lose a portion of his pension that he worked 40 years to build because he can't retire fully till February of 2022. I'll be next. I work in the healthcare industry. That's just a matter of time. What happens after January 1st? People in Connecticut are already being put on LOA. And if you don't know that, people aren't getting fired and laid off. They're being put on LOA so no one gets unemployment. They're saying it's their choice. They could have got the jab, but they chose not to, so you don't get the pink slip. And because they can't, we are being lied to. We have worked our whole lives in this state. We were never a burden on our taxpayers. We are only one family in this story, and there are thousands more. Why do we have to stand here and fight to gain back our freedoms that are allowed to us in our Constitution? All because one man in a governor's seat in Connecticut is either too weak or in bed with the devil himself, and I suspect it's both. And stand for what is right for the people in this state. I've raised 5 sons in this state. We have 9 grandchildren. People have said to me, what are you doing in this fight? It's not your fight. I said, oh, yes, it is. I have 9 dogs in this fight, and they're called my grandchildren. My husband has a corporation behind him that are all fighting right now to save their jobs. Pensions on the line. Early Social Security cut in half if they are terminated. We're here fighting for our kids, our grandkids, and to keep our jobs, and to stand with all you other people as well. Tell me, when will those powers that be stand with us? Do the right thing. Remove Lamont's executive powers, or this state's going to be unrecognizable in the very near future. We are all more than just a vote. You have a voice. You can be loud. We're doing what you've asked of us. We're being loud. We need you to be loud with us.
Thank you, Patricia.
I have more to say I'd like to present, if I could, with the letter that came on the website from Pratt & Whitney, if anybody be interested.
We certainly would take a copy of that. I appreciate that.
Yes, sir, I have it right here.
Excellent. Could you describe your experience as a nurse, like what you've done as a nurse?
Yes, sir. I was a nurse. I'm an ICU nurse, trauma nurse, PCU nurse, critical, you name it, I've done it. Stroke teams, coordinators. I saw the wave coming when Hartford Healthcare started buying out all the big, small hospitals. I said, we're going to have some problems here. I got involved with the union and became a vice president, and I was a very strong voice for the people. And I spent many, many hours negotiating with them. When this all started, I said to my husband, I need to leave the clinical field because I can't in good conscience do what they want us to do. I can't stick something in a vein knowing it's going to kill someone. I can't stick a tube down someone's throat knowing this is not the right protocol. The drugs they're using are not correct. And in good conscience, I took a moral oath to do no harm, and I will do no harm. I was one of the strong ones that could stand up. I left that. I now work for a private company, which hasn't affected me as yet, so I won't speak on that. I'm here on behalf of Raytheon and Pratt Whitney, because if they do this, and they're allowed to do this, and they are doing this, we will be financially ruined.